Hi, I'm Chris Brown. I'm with Abbey Senior Health in O'Fallon, Missouri. Today I want to take a little bit of a deeper dive into skilled nursing. Skilled nursing is kind of a confusing term. What is skilled nursing? Well, skilled nursing is the highest level within the senior living environment. We have independent living, where there really is no care. The middle level of care, assisted living, which helps with a couple of those activities of daily living. And then we have skilled nursing, where when we talked about the activities of daily living, things like eating, bathing, dressing, grooming, right, walking, transferring, all those things. In skilled nursing, that's where you see someone maybe needing help with all of those things. It could be someone who's even bedbound or in a coma would be in skilled nursing. Now, we have people in skilled nursing that are far from being bedbound. They're very lively, active, living healthy lives, but they need some level of care more than what assisted living could offer. And so that's why they're in skilled nursing. So skilled nursing is really an overall term where we talk about a doctor and a registered nurse overseeing care of someone in a Medicare or Medicaid certified facility. And that's what we are here at Abbey Senior Health. Abbey Senior Health is a Medicare and Medicaid certified facility. So what does that mean? Well, it really means that the nursing home care is broken down into two levels. One being short-term rehab. So if someone comes into skilled nursing, they've had an episode of illness, they've fallen and broken a bone, or they've had a hip replacement, and they're not able to really get back home yet, they need more convalescing time, they would come to Abbey Senior Health, our skilled nursing facility, and they'd be here anywhere from a week to 3 weeks, but even up to as much as 100 days. Medicare will cover up to 100 days of rehabilitation following an episode of illness for someone to get back on their feet again so that we can return them home or to their previous level of care. That is where we throw out all the stops, right? We're going to give them good registered nurse care. They're going to be overseen by a physician who's going to put a great care plan together. And we're going to give them physical therapy, speech therapy, occupational therapy, as well as respiratory therapy. And so here at Abbey Senior Health, we even have a physician that's called a physiatrist that oversees the rehab level of care that someone receives. So we're going to do all of that type of care for that person and help to get them back home. That's usually done within 2 to 3 weeks. Let me just talk about how that's paid for. Medicare, or managed Medicare, which is something a little different than Medicare, but all in the Medicare guidelines, will cover up to 21 days of rehab care without any co-pays. But on that 21st day, then a person has to then contribute $200 a day towards that care. Now that comes out of someone's own individual pocket. It may come out of supplemental insurance. It may come under long-term care insurance, but that responsibility is the patient's at that point in time after that 21st day. So let me talk about the other side of skilled nursing, which is just a long-term custodial care. Sometimes you'll have that bedbound resident who needs care. They can't be in assisted living any longer because they can't find that pathway to safety. So they need long-term custodial care. That's paid for one of two ways, really. It's paid for out of private funds. It can be paid for out of long-term care insurance policy funds if someone has a long-term care insurance policy. Or it could be paid for through the Medicaid program, but someone would have to qualify for Medicaid, and that would mean that they didn't have any assets and they would have to financially qualify and apply for a Medicaid bed, and the facility would then be paid for through that state and federal program under Medicaid. Skilled nursing can be quite expensive. You can generally see costs ranging somewhere between $7,000 a month and $12,000 a month for skilled nursing care, depending upon the level of care that's needed and the facility that that person would be going to or being a part of. So at Abbey Senior Health, we do skilled nursing on a short-term basis. We do skilled nursing on a long-term basis. We do a great job with the custodial care and as well as the short-term care. But we also have assisted living and the independent living here all on the same campus. We're known as a continuing care retirement community. Hey, I hope this video was helped. We have more information for you on our website, abbeyseniorhealth.com. where we have some other deep dives into what senior care is all about.